In this video, you'll get a quick overview of Vibrant's Toxin Genetics Test. I'll explain the Vibrant advantage and the technology used. Then I'll walk through each section of the test, highlighting key features. I'll also suggest complementary tests and end by summarizing the key takeaways and where to go for additional information. Genetics significantly influences detoxification processes in the body. Specifically, genetic variations in enzymes involved in phase 1 and phase 2 detoxification pathways can impact an individual's ability to metabolize and eliminate toxins. These variations can lead to differences in detoxification efficiency, potentially affecting susceptibility to environmental pollutants, drug response, and disease risk. For example, phase 1 detoxification involves cytochrome P450 enzymes, which are central to phase 1 detoxification, where they introduce functional groups to toxins to increase their water solubility. Genetic polymorphisms, or SNPs, and CYP genes can lead to variable enzyme activity. Phase 2 detoxification involves conjugating toxins with water-soluble molecules to facilitate their excretion. Glutathione S transferases and UDP glucuronylyl transferases are key enzymes in this phase. For example, genetic polymorphisms in GST genes can influence susceptibility to various cancers and other diseases, and genetic variants in UGTs can affect the metabolism of drugs and environmental toxins. Vibrant's Toxin Genetics Test identifies relevant genetic variations that can affect detoxification of environmental toxins, heavy metals, mycotoxins, PFAS, and xenobiotics. In other words, the Toxin Genetics Test helps determine your patient's risk for impaired detoxification. Vibrant's Toxin Genetics Test can be collected via blood or saliva. For blood, patients collect 1 EDTA tube. Fasting is not required, and there are no diet or medication restrictions. For saliva, patients collect 1 saliva specimen tube. Again, fasting is not required, and there are no medication restrictions. However, patients should avoid foods high in sugar or acidity or high caffeine content immediately before sample collection. And for best test performance, avoid eating a meal within 60 minutes of sample collection. Additionally, patients are instructed to rinse their mouth with water to remove food residue and wait at least 10 minutes after rinsing to avoid sample dilution before collecting saliva. Vibrant's Toxin Genetics Test uses real-time PCR methodology for accurate identification of genetic variations. Briefly, genetic material is extracted and purified from saliva samples, and single nucleotide polymorphism or SNP genotyping assay is performed to detect the specific allele targets for each assay. RT-PCR is the gold standard for identification of genetic material, so results are accurate and precise. Before we dive into the actual report, I want to remind you that you get to choose how much information to include in the report you download for yourself or the report you share with your patients. You have 3 options: summary, interpretation, and all markers. I'll be going over the report that includes all 3 options combined, as it is the most comprehensive. Let's start with a quick overview. The Toxin Genetics Sample Report includes a cover page, introduction, summary with interpretation, and then lists all markers. The cover page identifies the sample type and includes the results interpretation key. The introduction page is where you can find the methodology and interpretation of report, and I highly recommend reading this page, especially the part where it says, the mutation alleles are indicated with a plus symbol and the wild type alleles are indicated with a minus symbol. Meanwhile, risk-associated variants are indicated with red or yellow, and alleles with no risk are indicated with green. As well as the part that states, all contents provided in the report are purely for informational purposes only and should not be considered medical advice. Any changes based on the information provided should be made in consultation with a medical provider. The summary shows the elevated and partially elevated risk result along with the interpretive comment. And the full report lists the results of all markers, including SNPs impacting detoxification of xenobiotics, environmental toxins, heavy metals, mycotoxins, and PFAS. High-risk associated variants are indicated with red. Partially elevated risk associated variants are indicated with yellow. And normal risk associated variants are indicated with green. Note that mutation alleles do not always correlate with risk. For example, the plus genotype for the COMT SNP and the minus genotype for the EPHX1 SNP are both associated with elevated risk. If you want to learn more about the genetic predisposition flagged red or yellow, you can scroll back to the summary and read the interpretive comment. You can take an even deeper dive by checking out the Toxin Genetics Interpretive Guide in your provider portal. So, which patients benefit most from this test? Well, conditions and symptoms which may benefit from toxin genetic testing include neurological conditions like Alzheimer's and Parkinson's disease, gastrointestinal dysfunction like diarrhea, bloating, or chronic gastrointestinal tract infections, skin manifestations like eczema and rashes, chronic fatigue and weakness, respiratory issues like coughing or wheezing, mental and emotional symptoms like depression or anxiety, cardiovascular symptoms like irregular heartbeat, sleep issues, and other symptoms, including morning stiffness or joint pain, metabolic taste in the mouth, light sensitivity, multiple chemical sensitivity, and adverse reactions to medications. Before we talk about complementary tests, I want you to think about Dr. Sidney Baker's TAC rules. Rule number 1. If you're sitting on a TAC, it takes a lot of aspirin to make the pain go away. In other words, it's difficult to heal if you don't identify the root cause of your symptoms. Rule number 2. If you're sitting on 2 TACs, removing one does not necessarily result in a 50% improvement in symptoms. In other words, sometimes there's more than one root cause contributing to your symptoms. In addition to toxin genetics, consider the total tox burden and PFAS test to assess an individual's specific level of toxins in the body. Also, the micronutrient panel or NutriPro to investigate intra- and extracellular micronutrient levels required for detoxification. Note the NutriPro test detects nutrition-related genetic SNPs in addition to nutrient levels. And finally, hormones, since impaired detoxification pathways may cause endocrine disruption and hormonal imbalances. In summary, Vibrant's Toxin Genetics Test uses gold standard RT-PCR methodology to identify genetic variations impacting detoxification of environmental toxins, heavy metals, mycotoxins, PFAS, and xenobiotics, helping you determine your patient's risk for impaired detoxification. To learn more, visit the link in the video description. If you have questions, please ask them in the comments below this video. Thanks for watching, and I hope you have a vibrant day.